Health has been a big part of the theme this week here on the program. We've been talking about health from a variety of different angles. Because, look, I think part of the job of what we do here is to make you aware of the most relevant information, the latest breaking news, the most important things that keep you healthy. And that's why I'm bringing in Dr. Drew Pinsky. You know Dr. Drew, of course. He is the Chief Patient Officer at the Wellness Company, and he's joining me now. Dr. Drew, nice to have you on the program.
Always good to be here.
All right, so front and center last week, Bobby Kennedy. Man, he was just being attacked during a hearing with the United States Senate. And look, here's a guy who has been asking, I think, reasonable questions. All right, if you've got mercury in your vaccines and lead in your vaccines or aluminum in your vaccines, whatever the heavy metal might be, isn't it reasonable to ask, why are we doing this? Why are we forcing people to take these vaccines, which are now 70 or 80 deep?
Yes.
Shouldn't we be asking more questions? Isn't that the right thing to do?
Of course it is. It's what we always do. And the fact that these senators took issue with that should be a red flag for everyone. But what I saw was a group of senators that do not understand health care. They particularly don't understand public health. And the only senator that I heard say anything close to sane was the senator from Rhode Island, who really seemed to understand the nature of the problems in healthcare. He was focusing in on distribution of resources and end-of-life care, where we waste insane amounts of money. And Kennedy appropriately said, we're gonna look into that. That's healthcare. The rest of it was grandstanding. When did they become an expert in public health? I want to be super clear. Public health care is not health care. These are two separate systems, and they are at odds with one another, and public health has run amok lately.
Yeah.
Now, you see down in Florida, Dr. Latipo is taking away mandates, taking away some of the teeth from the public health excesses. Not that people shouldn't get vaccines, not that vaccines aren't important, but that the government should not be mandating these things. And Florida joins 88 other countries, including most of the EU, and 3 of 5 communist countries. China doesn't have mandates. So let's be serious here.
Yeah.
What are these people talking about?
Yeah, hard to say. Look, when I was a kid, I think it was 7 or 8. That's what the vaccine protocol was, 7 or 8. Now it's 80. And one of the things I've heard people say, you included, the hepatitis B vaccine given to a child right after they're born, unless they're an intravenous drug user or having unprotected sex. We're talking about newborns here. What are we trying to protect them from?
Well, the conceit would be you're trying to protect the hepatitis B transmission vertically from the mother, who does not have hepatitis B. And by the way, a delivering mother who doesn't get a hepatitis B screen, who particularly has a history of IV drug use or indiscriminate sexual activity or something, if that woman is not tested for hepatitis B, that is malpractice. And when she is tested for B and turns up positive, that child gets the vaccine. I was in and around the research. My residency director did the original research on hepatitis B. We were concerned with mother-to-child transmission of hepatitis B in China, where they had a big problem with it. The World Health Organization, it appears, somehow got a hold of this and they seem to be the ones that mandating it in this country for no reason that I can see. I don't understand. You can get it later. Adults get it. I got it in adulthood. No problem. Why are we giving it on the first day of life? It seems
doesn't make sense.
Absolutely indefensible to me.
A newborn really doesn't have an immune system that's fully equipped to deal with the world. That's why breastfeeding is so important from a newborn to its mother, right? Because her immune system is basically being transferred to the child, correct? So this idea that we need to continue to jab these kids 70 or 80 times is bizarre to me. One of the big exchanges I saw between Robert F. Kennedy Jr. and I don't remember which senator, because it kind of became a blur, was talking about myocarditis. And he said, are you telling me, Senator, there's no concern about myocarditis when you talk about the COVID-19 vaccine? I mean, he had him on the spot. They can attack Bobby Kennedy all they want, but the facts seem to line up on his side of the ledger, right or wrong.
Well, let's just think about it this way. To make a mandate, to require somebody to violate their bodily integrity on behalf of the group, you must first do no harm. And the risk reward must be there for the individual you're offering this to. Even though it's for the good of the community, you don't have a bioethical standing if you harm the person you're giving this to. Now, think about this. 20-year-old males have a near zero, particularly healthy males that are going to school, near zero probability of hospitalization or serious illness from Omicron. Forget about Alpha and Delta. That was a different illness. We are in a new phase of this condition. Omicron, 20-year-olds, not sick, not hospitalized. If you give them a COVID-19 vaccine, the risk of myocarditis is non-zero. It's actually maybe as high as 0.5% or so. It's non-zero. So you're only putting that kid in harm's way for no reason. And of course, we also know that the vaccine does not prevent spread. They keep falling back on, well, it reduces hospitalization.
No, it doesn't.
Not in a 20-year-old because they're not hospitalized.
Correct.
It's a zero issue. You are only putting that child in harm's way and accomplishing nothing. The kids that were mandated and got myocarditis is a terrible illness. This whole thing that people went through, just mild myocarditis. There is no such thing. You are risking needing a cardiac transplant in 10 years. It's a major deal.
Is there anybody, doctor, that you would recommend getting the COVID-19, and I'll use the term vaccination, today? Is there a group of people that you would, obviously not 20-year-olds, obviously not young people younger than 20. I don't even think people in their 30s and 40s if they're healthy. Is there any group you would think maybe they could get a COVID-19 vaccine? It would make sense. It would be safe.
So let me frame it two ways. One is I want doctors to have everything at their disposal to do whatever they think is the best interest of the patient in front of them.
Fair
everything. The CDC, what is their job? They don't practice medicine. The FDA doesn't practice medicine. I taught medicine for 20 years. Well, here's words that never came out of my mouth. What does the CDC tell you to do? Ever. They're advisory. They're in the background. They're helping us understand the data that's circulating around that patient that we're making a decision about. A 70-year-old patient who has been wanting the boosters and tolerated them well, okay, seems like a net benefit. Although I've had a few severe reactions, even in the very advanced. I had a 100-year-old that almost died. When I reported that to VAERS, that was a year and a half ago, they have ignored me to this day. So the VAERS system clearly is broken. And so if your patient gets a bad reaction, even after tolerating the vaccines for a while, it does happen. But I understand if a physician feels that's a net benefit for an elderly patient with many medical problems, no problem in my mind.
Right. They're following the ethical code of conduct as a physician. That's an acceptable path. All right. So the spike protein supplement sold by the wellness company, considered to be the gold standard. It's the ultimate spike protein product. I've been taking it for some time. I was somebody, look, people know. I got talked into getting the first 2 jabs. It made me, I got very sick from it. I got, I couldn't stand up straight, right? Mm-hmm. I had vertigo like I've never had in my life. Bizarre thing that had happened to me, and it was strange. Didn't report it to anybody. But the spike protein formula, we've got just a few seconds here. What would you say to people about having it?
It seems to work. Dr. Peter McCullough is making an entire practice of treating long COVID and long vaccine, and he's having excellent results with high dose of nattokinase, which we put into that spike protein and spike detox product. So read what's out there. Follow Dr. McCullough. He's an expert now. I'm going to interview him this afternoon, in fact, and get an update from him. There's a lot going on.
All right. TWC.health/Gruber. Get the gold standard when it comes to a spike protein supplement. TWC.health/Gruber. Dr. Drew, always an education, sir. Thank you for being here.
You bet, Steve. Thanks.
All right. Trust the Wellness Company. They put out the gold standard in a variety of ways. TWC.health/Gruber. Find out more right now.